The only way to find a cure for cholangiocarcinoma is through research, and that's exactly what our next guests are doing. Dr. Katie Kelley and Dr. Tim Greten are recipients of a $250,000 innovation grant from the Cholangiocarcinoma Foundation, and they join us now to discuss their work. Dr. Kelley, I'm going to start with you. What are the challenges of treating a rare form of cancer like cholangiocarcinoma? And how is this grant going to help you?
So rare cancers and all cancers pose challenges because every patient in and of themselves is an individual with unique factors and details that are critical to deciding the right treatment for them. But when we step back and try to make progress and do research, we need to have enough patients, enough doctors with expertise, enough centers with the critical mass of patients and doctors with expertise, and then an understanding of the specific drivers of an individual cancer, both of response and resistance. And one of the challenges specific to biliary tract cancers, including the rare type of cancer we call cholangiocarcinoma, is that they are exceptionally complex anatomically and biologically. And part of that complexity is that they have an inherent resistance to our own immune system's mechanisms of immune control and treatment of the cancer, immune response to cancer. And so when we've branched out into this renaissance in oncology that we're experiencing in other tumor types of using our immune system and drugs that harness the immune system to fight cancer, we're not seeing the same responses in cholangiocarcinomas that we are in many other tumor types. And there turns out to be mechanisms of resistance perhaps unique to cholangiocarcinoma or unique to some of the other types of cancers that are resistant to immunotherapy. And so what we're trying to do with this grant is coalesce enough patients and enough providers with expertise in this cancer and enough samples from those patients to be able to study these in a concerted way and identify what are those specific immune mechanisms of resistance that we can then target and help turn the immune system in cholangiocarcinoma patients to a more responsive behavior and allow us to get those deep and durable responses we want.
Well, let's talk to you, Dr. Greten, about how this is going. Tell me about recent advances that have been made and where you see this research going.
Yeah, that's a very interesting question. And, I would, let me start out with the entire field of oncology that has really dramatically changed in the past, let's say, 5 to 10 years with the advent of immunotherapy, number one, as well as molecular targeted therapies. And cholangiocarcinoma, as an example for a rare cancer, is a perfect example. For this particular indication, we now have cytotoxic chemotherapy that we've been using for a number of years, but there are increasing number of reagents that are specifically targeted to molecular changes, which we find in cholangiocarcinoma, IDH mutations, FGFR fusion, just to name a few, as well as immunotherapy that we had just talked about. And these treatments have now become standard of care. They are FDA approved. And what we're currently doing is we're trying to see if we can improve the outcome and the efficacy of this treatment, but we're also trying to see how we can potentially combine these treatments. And I think those will be dramatic changes, hopefully coming up in the next few years.
All right, the last question is for both of you. Dr. Kelley, I'll let you answer first. Why is it so important to collaborate on this type of research?
Collaboration is essential, especially for rare cancers like cholangiocarcinoma. And in part, it's because we need collaboration to build a foundation, like a foundation of a house, to create an infrastructure to collect samples, to collect ideas, to collect the databases, to pool what are really rare numbers of patients at individual sites into a critical mass that lets us make progress, whether it's serum samples or tissue samples or cell lines that we can study in mice. We need a network, and we need a foundation like Cholangiocarcinoma Foundation support to help build that network and for communication, as well as logistical shepherding of samples and data between multiple sites.
Dr. Greten?
Yes, let me add, even if this is a rare cancer, there are still many different aspects that we study in cancers. And that's why, it is so important to collaborate, because different investigators and, specialists have different expertise. And, some are more clinical, some are more preclinical, some have more expertise in molecular medicine, more in immunology, and, getting here different experts with a different perspective, I think, is pivotal to advance the field.
All right, Dr. Katie Kelley, Dr. Tim Greten, thank you both very much, and good luck with your research.
Thank you.
Thank you.
And thank you for tuning in. We'll see you again next time. Bye-bye.